Our next guest is another common sense conservative who has been involved in the healthcare system. She's a critical care registered nurse. She's the district coordinator for Concerned Women of America. And if you've ever read STL Urban Spice, this is STL Urban Spice, Stephanie Rubach.
Hello. I'm so glad to be with you all this morning to talk about health care and how a massive government takeover will affect professional nurses. Hey there back there. America's healthcare system is the best there is, and I'm proud to be a part of it. As a registered nurse with over 20 years of experience, I've seen my share of advances in modern medicine. In many ways, American medical technology is the envy of the world and will continue to be if left alone and left with the ingenuity of America's spirit. Just let Americans handle our health care. Because health care is too fundamental to be controlled by the government, where its distribution will be inefficient, it will be controlled by the bureaucrats, and reserved for the privileged. Yes. You know, it may not be perfect, but let's fix the problem without destroying the entire healthcare system. The plan proposed by the Obama administration will make things far worse, and it's just another assault on our values and on our system. I've cared for patients without regard of their ability to pay or of their social economical status. I've treated the young teen dying of HIV/AIDS to the multi-millionaire Hall of Famer. Either way, I'm a nurse. I give excellent quality patient care because that's what everyone deserves. However, what I see with the Obama plan is patients being left out of the decision process. I see patients losing their choice of doctors. I see patients losing control of their health insurance options. I see patients losing timely access to quality health care. And also patients losing money by paying for a government takeover. But we can't sit by and let this happen. But everyone in the United States should have a right to good health care. But how do we get from there? How do we get there from here? Obama seems not to realize that it takes more than money to expand our healthcare system. You need nurses and doctors. But it takes about 4 years to train a nurse and almost a decade a doctor, and then additional years of training is needed for specialty areas. So unless you expand the number of nurses and doctors to care for the influx of the 50 million uninsured, I mean, there will be even more nursing burnout, and the shortage rate will definitely increase. If you look at the number of doctors has only increased about 1% a year for the past 5 years, and for nurses, that number has stayed about 1.4 million for the past 4 years. But yet our population increases about 3% a year. So we're not even keeping pace. So even with the increased recruitment effort, there's still a severe nursing shortage. Across the United States, there's been just massive efforts to recruit nurses. There's been nurses coming in from overseas, and I've talked with nurses and doctors with that experience because it's happened here in St. Louis where we bring in nurses from a different country, and there's so many problems with that. Usually a language barrier. So there's more errors. Patients are just not happy. Patients are not satisfied. So that really is not the solution. Also with the controls that Obama is proposing, this translates into income control for nurses and doctors, which will still lead to fewer people coming into the profession and will contribute to the nursing and physician shortage as well. So we will see further stretching We'll see further stretching of healthcare services to cover a larger number of people and ultimately to rationing of services. We do not want that. We see the consequences of this in Canada and in Great Britain, where the bureaucrats make decisions for people. And these decisions are based on age and cost. The care is prioritized and rationed. And as you know, as you've probably heard already, waits in those countries are often months long, and often the condition worsens or the patient may even die before the turn comes. But it's funny, I'm so amazed at the number of the politicians who are so quick to claim that a government-run health care plan is what our country needs. But exempts themselves from this option. They instead will keep their existing health plan and services. So if members of Congress believe so strongly about this, if they believe so strongly about this government health care plan and that this is the best solution, then why are they being exempt? That's what I want to know. Why are they exempt? I'm going to start this up real quick. So they think this is the best. They think this is the best healthcare plan for working Americans, but they should lead by example and be accountable for what they are advocating. So I challenge all Americans to demand this from their representatives. After all, they are public servants. That's right. Instead, they think they know, well, they actually know there are better options, and they want to keep those for themselves. So we're slowly seeing our freedom to choose on a number of different fronts being restricted. And that's really what's going on. I'm encouraging Washington, D.C. to slow things down and not make irresponsible decisions that may be in violation of our basic principles of a free society. Why is this great rush of government expansion into healthcare that may affect every American? What is the great rush? I don't know about you, but I had my share of Obama drama for the past 6 months. Let's slow it down. Let's read the bills and see what's going on. I would like to see nurses and doctors who are actually at the patient's bedside engage in this health care debate. Our health and our freedom to choose a type of health care as individual citizens is one of our most precious assets we have and must be protected. Because every patient deserves a professional nurse that is knowledgeable and caring, not a quickly trained government worker just thrown together. As Barack Obama said, health care could be cheaper if we don't give old folks in the firm the full measure of care they now get. He said that. I cannot support a system that will not only decrease patient care, but will make the entire healthcare system worse. As Ronald Reagan said, whenever a voice is raised telling you to let the government do it, analyze very carefully to see whether the suggested service is worth the personal freedom which you must forego in return for such a service. So please say no to Obamacare.
Thank you, Stephanie.